Dr. GaborMate, you talk about adverse childhood stresses as ACEs.
Yes, there was a...
And their connection also to addiction, this latest book that you have written, In the Realm of Hungry Ghosts.
There was a number of large-scale studies in the United States done by very brilliant researchers called the ACE studies, ACE, Adverse Childhood Experiences. An adverse childhood experience is a child being abused, or violence in the family, or a parent being jailed, or extreme stress or poverty, or a rancorous divorce, a parent being addicted, alcoholic, and so on. When it comes to addiction, these effects are additive, so that if a child has a number of these adverse childhood experiences, his chance of becoming a drug addict later on, or any kind of an addict, go up exponentially. So a male child with 6 such adverse childhood experiences has a 4,600% increase in the risk of him becoming an injection-using substance addict than a male child with no such experiences. In other words, a 46-fold increase in the risk. And interestingly enough, those adverse childhood experiences also exponentially increase the risk of cancer and high blood pressure and heart disease and a whole range of other diseases, as well as suicide, of course, and early death. In other words, there's a real connection between early childhood adversity and how a person lives their lives and the later appearance of addiction and diseases, physical and, of course, mental illnesses at the same time. And if we don't take this into account in medicine, most of the time people are not asked about these things in doctors' offices, and they're not explored, they're not encouraged to explore their childhoods and the kind of impact that the childhood has on their adult behaviors.
As we wrap up this part of our discussion, what do you think are the most useful ways people can deal with stress, with the mind-body connection, both people themselves and also what doctors should be telling their patients or what patients should be telling their doctors?
The body has many ways of saying no. Almost any symptom, a stomachache, a back spasm, a headache, nausea, dry mouth, poor sleep, muscle tension. I'm talking about relatively minor symptoms. These are all ways of the body saying no, as of course are the more severe conditions like psoriasis or ulcerative colitis, all the ones that I've already mentioned. These are all ways of the body saying no. We need to, first of all, to say and pay attention to what the body's saying to us. So if we have a symptom, don't just go to the doctor and say, take this symptom away from me. Yeah, ask for help, but also explore what the body's saying no to. Usually you'll find that in your life you've taken on too much, you're suppressing yourself, you're trying to please others too much, you're living life along patterns that don't express who you really are. So the symptom or the disease ought to be not just something that you want to get rid of, it ought to be the beginning of an exploration and investigation of how you live your life and how you might possibly live your life differently in a more healthy fashion.
And do you think modern medicine is dealing better, Western medicine, with this, with the mind-body connection?
There are encouraging signs. There's certainly people like John Kabat-Zinn, who talks about stress and mindfulness, and Andrew Weil, who talks about the importance of nutrition and a more holistic approach. So there are many people doing great work, but if I look at the profession as a whole, we're doing a dismal job. And we're spending billions of dollars on researchers into cancer and so on. That's never going to get us anywhere because we ignore the life stresses that very often, if they're owned by themselves cause, they certainly contribute in a major way to the onset of disease, but we're not looking at them, we're not dealing with them, and we're leaving people without the appropriate tools to restore their own health.
Dr. GaborMate, I want to thank you for being with us again from Vancouver today. As we break the sound barrier, he is a best-selling author in Canada, now bringing him to the United States. The book we're talking about, When the Body Says No, Understanding the Stress-Disease Connection